So next, I would like to use a case from my family practice to illustrate what we've been discussing so far. So I'm going to introduce Mrs. Smith. She's a 72-year-old retired engineer who lives on an acreage in Princeton, BC. Her daughter has asked to make an appointment with myself to discuss her mother's bad nerves. Mrs. Smith's past medical history is significant for high blood pressure, insomnia. She's had 2 recent ER visits for injuries related to falls at home. Ms. Smith takes 2 different blood pressure medications and a sleeping pill occasionally when she struggles to sleep. Mrs. Smith thinks it's probably her blood pressure pills that are causing her falls, but her daughter wonders if she has early dementia, which is showing up as anxiety. Mrs. Smith enjoys wine. She feels that the wine relaxes her nerves and helps her sleep. So as a physician who treats a fair amount of alcohol use disorder and has my own family practice as well, there are certainly a few features of her story that are setting off some alarm bells for me. Specifically, her history of anxiety, high blood pressure, insomnia, recent emergency room visits for falls, possibly some concerns about memory impairment as well. As we all know, these are certainly all things that could be related to alcohol use. So it's important when first bringing up this issue with the patient to do so in a non-judgmental, polite way. One way I frame this with my patients would be to ask in a way such as this: Mrs. Smith, do you mind if we talk more about your alcohol consumption? If she's not ready to discuss it or does not see it as an issue, she may say no, and that's okay. This is something I might write down on my chart and continue to bring up at a later date. However, lucky for us today, Mrs. Smith is more than happy to discuss this issue further. So Mrs. Smith tells me she drinks 3 glasses of wine per day, sometime more on a special occasion. She lost her husband 5 years ago, and they used to enjoy wine with dinner. She finds she drinks wine with dinner as a way to remember him. She tells me if I don't drink, I feel sad. She also said, the kids don't come around much anymore. It's just me and the cat. She also said, my dad is an alcoholic, and I know I'm not like him. So Mrs. Smith, I hear you're struggling with some mood changes such as anxiety and depression. I wonder if these things, along with your poor balance and recent falls, your possible memory troubles, your sleep disturbances, and maybe even your hypertension, these may all be related to your alcohol use. And I'm worried that you're consuming at a level that is not safe. Mrs. Smith and her daughter were receptive to my concerns. We spent our remaining visit setting an obtainable drinking goal. We reviewed the tools available to help her succeed. Specifically, how could we support her psychologically? How could we support her socially or spiritually? And what biological factors are at play, and what medications could we use to address them? From a psychological standpoint, sounds like she misses her husband. She may be struggling with some grief, bereavement. She may be using alcohol to cope with this. From a social standpoint, she's telling us that she misses her children. She's feeling lonely. From a biological standpoint, sounds like she may have a genetic predisposition to drinking given her father's history of alcohol use disorder. She certainly may be experiencing some symptoms of alcohol withdrawal, such as anxiety and insomnia. Certainly, her high blood pressure may be a manifestation of her overuse of alcohol as well. I continue to work with Mrs. Smith over the subsequent 1 year. She's now living on her daughter's property. They enjoy alcohol-free dinners as a family together once a week. She continues to see a counselor once a month. She's an active member in our local senior group. From a medication standpoint, we prescribed a Camprosate given her goal of abstinence. This was started in the first few days after she stopped drinking. We also augmented with gabapentin as she was still struggling with symptoms of increased anxiety and insomnia. We later stopped both of these medications, and she now carries a prescription for naltrexone, which she uses when she goes out on social occasions where there will be alcohol. She feels that the naltrexone helps prevent her from indulging too much. We've also been able to stop both of her blood pressure medications, and her blood pressure remains at target. She no longer requires sleep aids and sleeps without the assistance of alcohol.